Hi, this is only my second video and it's about the reproductive system and where babies come from. And this is intended for the general public and teenagers. And really this is just for educational purposes and even college students, although this is going to mostly be basic for you, you may find a few interesting facts within this video. So in this video we'll go over the anatomy of female and male reproductive system, why girls have periods, pregnancy, a little bit about contraception and about teen pregnancy. Teen pregnancies, there are approximately 12 million babies born to girls aged 15 to 19 years old worldwide, and 777,000 are born to girls under age 15. Many of these children are born in developing countries, such as located in East Asia, Western Africa, and South America. In the USA, there were 194,000 teen pregnancies, and this has dropped in half from just a decade ago. And overall, the teen pregnancies worldwide has also decreased by half from a decade ago. And this is due to education, being in school until an older age, having access to better care and/or contraception. Okay, in order to understand how a pregnancy occurs, let's go over the anatomy of a female and of a male. So here is the anatomy of a female. Basically, this is the uterus, which is where the baby is carried. And attached to that is a fallopian tube and these ovaries. Now the ovaries are what contain the eggs. And then you have a cervix and a vagina. And we'll talk further about what their role is on the next slide. So all of this is located within the female pelvis. Okay, this is a complicated slide, and this shows you everything that's happening to a woman during her monthly cycle. And it's divided from day 0 to day 28, which is the length of the cycle, and the first 5 days are when the period starts and ends. So if you look at the top of this chart, you'll see what represents the thickness of the endometrium, or the uterine lining. So the bottom part that's darker is the stable part of the uterus that's always present. And due to hormones, you have this thickening of the endometrium, and it reaches a maximum around day 20. So if a pregnancy occurs and the zygote implants here, it'll have a rich blood supply from this thickened tissue. So if there's no pregnancy, then the cells and the uterine lining start sloughing off, and then that will exit the body through the cervix and then the vagina, and this is what you see as a monthly period. So, and what is causing this change in the uterus is the levels of hormones. So first, you can see the estrogen increases during the first half of the cycle, and this estrogen actually causes the uterus to thicken. And this is created by the cells that are surrounding the follicles that are developing in the ovaries. So the ovary has several follicles that will start maturing every month, and one will be released. So when the egg is released, that will enter the fimbria and then go into the fallopian tube. So it's in the fallopian tube that if it encounters a sperm and the sperm fertilizes the egg, that's when you develop a zygote and a pregnancy can occur. The rest of the follicle develops into what's called a corpus luteum, which is this yellow structure here after day 14, and it releases the hormones estrogen and progesterone also. And the progesterone is actually what will maintain the lining of the uterus for the second half of the cycle. And once again, if a pregnancy occurs, then this will continue to produce progesterone by another hormone, beta HCG. Now, if a pregnancy does not occur, then this tissue will die off, and then you'll get a period again. So the other thing that's going on in this graph at the bottom is the body temperature, which rises with ovulation. So if somebody wants to measure their temperature every day and then look for a day that it increases by a degree, then that is likely their day of ovulation. So this occurs at day 14 in a 28-day cycle. If someone has, say, a 30-day cycle, this may happen at day 16, for example. And then the second half of the cycle is kind of at an elevated temperature. So basically, it's an interaction of the hormones from the pituitary, which the LH and FSH, and the LH surge is what causes the egg to be released from the follicle, and they all kind of interact so that those levels also affect the estrogen and progesterone and vice versa. Okay, this is a slide of the male reproductive system, and so what's unique to men is, one, they have a penis, and they have a prostate and the testes. Now, the testes, which is located within the scrotum, this is what produces the sperm, and that carries the male DNA. So that's the second half of all of the cells in your body. So basically it travels from the epididymis and through the vas deferens and through the back of the prostate, and it mixes with fluid in the seminal vesicles in the prostate. And then this is released into the urethra, which then during ejaculation will exit the penis. So those are the basic differences. We discussed the female anatomy previously, and this is a male anatomy. So once again, the egg contains the female DNA and 23 chromosomes, and the sperm contains the male DNA, which also has 23 chromosomes. And when they combine, that'll be a total of 46. So sperm enter the vagina after intercourse or having sex. And the sperm have to swim through the cervix and into the uterus and then to the fallopian tubes. Now the egg is released, as we mentioned, on day 14, and sperm have to be present within that first 12 to 24 hours of release of the egg. If not, the egg will degenerate and can no longer be fertilized. Now, if someone has sex a few days prior to ovulation, the sperm can survive for the next 3 to 5 days within the uterus and fallopian tubes, and there's still a possibility of fertilization. Okay, so now that you've looked at the female and male reproductive parts, the female has an egg, and men create sperms. Each of these have 23 chromosomes, which is half of what a normal cell in your body would have. So once the sperm combines with the egg, there will be a total of 23 pairs, or 46 chromosomes. Once this happens, once you have a fertilized egg, then this one cell will start dividing, and this is a zygote, and then becomes the fetus, and then eventually the baby. So every cell has 46 chromosomes, and it comes from this original one cell, which is the egg and the sperm combining. And then if we go back, you can see part of the female reproductive system here. So again, from the previous slide, when I said at day 14 you have ovulation, the egg is released. This is the ovary here. Here's an egg being released. And then this is where it's traveling through the fallopian tube. Now, it's during this time when it's traveling through here that a pregnancy can occur. So here is an enlarged image of what's happening within the fallopian tube. If there are sperm present, and here's a picture of an egg, and here are the sperm here. Once one has penetrated through the egg, this is where the DNA of the male is carried. and the rest of them can no longer enter the cell. That protects the egg from having only one set of DNA from the male and one set from the female. So once the sperm penetrates that, that's when this will have two sets of DNA, one from the mother, one from the father. And once that happens, the egg will divide into two. So here you can see these are the chromosomes of the male and female. They're lined up at the center, replicated, and then they're split into two. So you have two eggs. So now you have two cells. So now you have two cells here. And then these will again divide, and you'll have four cells. So pretty much you'll see the volume is about the same, but these are dividing, replicating the DNA and then dividing again and again. So you get from a 2-cell to a 4-cell to an 8-cell stage, and further until it becomes what's called a morula. So it's a ball of cells. So this ball of cells will be traveling through the fallopian tube, and if everything goes well, it should implant in the lining of the uterus. So we were showing on the previous slide how the uterine lining becomes thicker during the course of the month. After day 14, it'll be at its thickest. So you need this in order for the morula, the ball of cells, to implant here. And this will become the future fetus and baby. Okay, so let's just go over how this pregnancy occurs once again. So when a man and woman have sex or intercourse, the sperm are released from the epididymis, mixed with fluid in the seminal vesicle and prostate, travel through the urethra, and are released into the vagina. Here, the sperm must swim through the vagina and into the uterus, and even the fallopian tubes. So the sperm are actually in a race to reach the egg that has been released at day 14. Pregnancy will only occur around mid-cycle or day 14 and over the next 4 or 5 days. So the first healthy sperm to encounter the egg in the uterus or fallopian tube can fertilize it. The head of the sperm has to penetrate the egg, and it will open and release its DNA into the egg. All the baby cells will then have a copy of the paternal or sperm DNA, and then the maternal or egg DNA. The sperm and egg become one cell with a complete set of chromosomes. So you have 23 pairs for a total of 46. So each time these chromosomes will copy themselves and then divide. And on the previous slide, we said how they go from this one cell into 2 cells, and then 4 and 8, and on until they form this ball of cells. So then after implantation, then they develop further. Now on the top of this slide, it'll show you how they're going from the 2-cell stage into a zygote and then the fetus, and the last picture is, at the 9-month stage. So during this time, organs are developing and maturing, and you can recognize a baby around after 12 weeks as a shape of a baby. However, it's not until about 24 weeks, which is 6 to 7 months stage, that if a woman were to deliver prematurely, that it would still be viable, meaning that we could provide enough intervention to allow the baby to survive. Before that, it would not be able to survive outside of the female. So here at the bottom, there's a picture of the female abdomen. Here's a baby, and it's contained within the uterus. So as the baby grows, the uterus grows in size and expands into the belly. And at 9 months, it's delivered through the cervix and then the vagina. In the case that there's a problem with delivery, sometimes a C-section is performed. So during the 9 months that a female is pregnant, the hormone levels change. Progesterone is actually elevated throughout the pregnancy, and that helps maintain the uterine lining. And this is what nourishes the fetus, in fact, is all the rich blood supply that comes from the mother. And so there's no period during this 9 months. So boys and girls will undergo puberty at an early age, around 11 or 12 years of age. However, in order not to have an unintended pregnancy, family planning comes into play. The best way to ensure that a girl or woman does not get pregnant is not to have sex. Some people will wait until marriage. In many cultures, this may be prohibited, in fact, before marriage. Other ways are the use of contraceptives. They can be a barrier method, such as a condom, so that the sperm are not released into the vagina. The other are birth control pills for women. If used correctly, they can be 97 to 99% effective, but there is always a risk. Other methods are not as good. One thing to keep in mind is that birth control pills cannot prevent sexually transmitted diseases. Only a condom can. So as a quick summary, we talked about the anatomy of boys and girls, what a period is, how pregnancies occur, how to prevent them until one is ready to have a baby. In fact, the reproductive organs and the relative amounts of hormones in the body are the only real difference between boys and girls. All other organs are the same in both sexes. And hopefully this is useful and understandable. And this is meant as a basic review for people and not really comprehensive as maybe somebody at the college level may need in their classes. So again, this slide just summarizes what I said on the previous slide about abstinence and not having sex in order to prevent pregnancy, condoms, birth control pills. And again, birth control pills cannot protect against STDs or sexually transmitted diseases. You would need to use a condom. But better still is not to have sex with a person that you know is infected until they've been treated, because there's always a chance that you could still develop, get the STD. So when I'm talking about STDs, examples are HIV, which would be very serious, and then gonorrhea and chlamydia. And the reason the latter two are important, in addition to symptoms that they cause and the fact that they can be spread to other people, is they can actually reduce the fertility or may decrease the chances of you getting pregnant in the future if the infection becomes severe. Now, the other reason to prevent pregnancies, of course, is a baby is a lot of responsibility and can be difficult to take care of. And lastly, teenagers are at higher risk of pregnancy complications. So I just put the hashtag until you are ready. So it's best to educate yourself, think about the consequences, and I hope this has been useful to you.